Good afternoon. Thank you for joining the Building and Implementing a Research Partnership webinar. During this webinar, our presenters, Dr. Edmund McGarrell and Dr. Faye Taxman, will review SMART BJA initiatives and the role of the Research Partnership. A few housekeeping items before we get started. There will be time at the end of the presentation for a question and answer session. To ask a question, please type the question into the Q&A panel on the bottom right-hand corner of your screen. We will do our best to answer your questions. If your question does not get answered during the webinar, please follow up via email after the event has ended. If you encounter technical or audio problems during the webinar, please call WebEx Technical Support at 1-866-229-3239. Please understand that there are some technical issues you may not be able to resolve. For this reason, we are recording this event and will be emailing the recording to all the attendees as well as posting it on our website shortly. My name is Sheila Coleman, and I'm a policy analyst in our Behavioral Health Division here at the Council of State Governments Justice Center. I provide technical assistance to jurisdictions awarded a Justice and Mental Health Collaboration Program grant, known as JMHCP for short. Through our work with the grantees, we know that having a research-practitioner partnership can assist in the implementation of data-driven approaches to reduce crime, improve community safety, reduce recidivism, and prevent unnecessary confinement. Our presenters today will be Dr. Ed McGarrell, who is a university professor in the School of Criminal Justice at Michigan State University. Dr. McGarrell's primary research interest is in communities and crime and the development of evidence-based strategies for violence reduction. Since 2002, he has led an MSU team that has served as the National Research Partner for the U.S. Department of Justice's Project Safe Neighborhoods, PSN, program. This has involved research on gun, gang, and drug-related crime and the impact of PSN, as well as the provision of research-based training and technical assistance to PSN task forces coordinated by the 93 U.S. Attorney offices across the country. Dr. Faye Taxman is a university professor in the Criminology, Law, and Society Department and director of the Center for Advancing Correctional Excellence at George Mason University. Dr. Taxman is recognized for her work in the development of the seamless systems of care model that link criminal justice with other service delivery systems, as well as re-engineering probation and parole supervision services and organizational change models. Her work covers the breadth of the correctional system from jails and prisons to community corrections and adult and juvenile offenders, including all types of interventions and system improvement factors. She has had numerous grants from the National Institute on Drug Abuse, National Institute of Justice, National Institute of Corrections, Office of National Drug Control Policy, and Bureau of Justice Assistance. I would like to thank our speakers for joining us today, and we're very excited to have them. I would now like to take a moment to give a brief overview of who we are here at the CSG Justice Center. The Justice Center is a national nonprofit, nonpartisan organization that serves policymakers at the local, state, and federal levels from all branches of government. Staff provides practical, nonpartisan advice and evidence-based, consensus-driven strategies to increase public safety and strengthen communities. At the Justice Center, one of our roles is to provide technical assistance to JMHCP and Second Chance Act grantees. Through JMHCP, the Bureau of Justice Assistance, BJA, has awarded $57 million in grants to more than 300 recipients in 49 states and territories. Justice and Mental Health Collaboration Program funding has a long history of bipartisan support beginning in 2004. Most recently, in December 2016, the 21st Cures Act, a milestone bill to address mental illness and substance use disorders in criminal justice, provided funding for the Justice and Mental Health Collaboration Program. JMHCP supports innovative cross-system collaboration to improve responses and outcomes for individuals with mental illnesses or co-occurring mental health and substance use disorders who come into contact with the criminal justice system. The Justice Center also operates the National Reentry Resource Center in partnership with BJA. There are 4 main objectives of the NRRC. Provide a one-stop, interactive source of current, user-friendly reentry information, identify, document, and promote evidence-based practices, advance the reentry field through training, distance learning, and knowledge development, and deliver individualized, targeted technical assistance to Second Chance Act grantees. Through our work at the Justice Center, especially with JMACP and SCA grantees, we know the important role a research partnership can play in designing effective programs. I would now like to turn the presentation over to Dr. McGarrell and Dr. Taxman.
Thanks, Sheila. I've had the good fortune to work with the Justice Center over the last 4 or 5 years to support the integration of research and research partnerships in smart supervision and reentry programs. And it's a pleasure to be able to continue and extend this collaboration today. I also want to thank BJA for their continued leadership in promoting the Smart Justice suite of grant programs that support states and localities in promoting the implementation of evidence-based practices and innovation to promote public safety, reduce recidivism, and enhance justice. It's also a pleasure to be presenting this webinar with my friend and colleague Faye Taxman from the Center for Advancing Correctional Excellence at George Mason. Faye and I are part of the Smart Suite Training and Technical Assistance Program that seeks to support the integration of research in BJA's Smart Suite of programs, and to work with the Justice Center and BJA's other TTA providers to support grant programs that cover the entire criminal justice system. Finally, let me thank all of you who are participating in the webinar for all you do to promote safety, serve your clients, and enhance justice day after day. I was fortunate over 20 years ago to enter into a research partnership with a multi-agency working group in Indianapolis that was focused on trying to reduce violent crime using a data-driven problem-solving approach. We were following a similar approach developed in Boston known as ceasefire, but there really was no model for engaging in this type of criminal justice practitioner-researcher collaboration. From the perspective of a researcher, I was intrigued by the opportunity to learn more about patterns of gun violence, but I had had no training in terms of what it meant to work as a partner in this type of collaborative relationship. My criminal justice partners were also wondering what the researcher in the room was going to bring to the table. One of my friends from the prosecutor's office used to joke, for what we were paying this researcher, I could have had another quarter of a prosecutor to bring more cases. As it turned out, this collaboration turned out to be one of the highlights of my professional career. I learned a great deal about the challenges facing criminal justice professionals. We learned how to use a variety of data sources to better understand the drivers of violence and to then craft prevention strategy aimed at these drivers. Ultimately, the series of strategies were shown to be associated with a significant reduction in violent crime. Since that time, I've continued to be involved in research partnerships through programs such as the Strategic Approaches to Community Safety Initiative, Project Safe Neighborhoods, and more recently in BJA's Smart Suite of grant programs. I've also had the good fortune to work as a local research partner in a series of programs in Detroit and Flint, Michigan, where the Michigan Department of Corrections is one of the critical partners. And as Faye will discuss, these years have also witnessed a series of initiatives in the corrections and court sectors that similarly involve research partnerships in the development and implementation of evidence-based practice. We've learned a great deal through these experiences, and I believe we are in a much better and different place than we were 20 years ago in terms of what we want out of the criminal justice researcher partnerships, how to create and sustain these partnerships, how they connect to effective implementation, best practices, and evaluation. As Sheila noted, our purpose in this webinar is to provide a foundation based on these lessons learned to support your efforts to build strong corrections researcher partnerships and to reach the benefits of these partnerships as you pursue your mission of promoting public safety, reducing recidivism, and enhancing justice. I'd like to begin by talking about DOJ's smart justice model. My interpretation of smart justice is the idea that, particularly in the context of limited resources, it is critically important that we use data analysis and evidence-based and evidence-informed strategies to ensure that our limited resources are highly focused and thereby maximizing the overall goals of promoting public safety, reducing recidivism, and enhancing justice. A critical aspect of these ideas is to increasingly identify and effectively implement evidence-based strategies. I've reached the age where each annual checkup involves discussion with my doctor about various health issues and prescriptions. One of my hopes, and I do feel this is true for my doctor, is that he is familiar with the latest research findings regarding preferred treatments, prescriptions, as well as the relative risks and benefits of various treatments and prescriptions. I expect my doctor to be up on the latest information and to consider the evidence base in light of my personal characteristics. The idea of smart justice is that we similarly want to be in the position in the criminal justice field, and corrections specifically, where we are asking, what does the evidence tell us in terms of working with clients in prisons, on probation or parole, in drug courts or other specialized courts, or as they transition from prison back to the community? Further, we want to continually build this evidence base of practice using high-quality research, and to also engage in research and have researchers assist in the most effective implementation of these practices. The smart justice model also includes this notion of creating criminal justice professional researcher partnerships to assist in these goals of development of evidence-based practice, identification of evidence-based and evidence-informed strategies and interventions, effective implementation, and evaluation. These partnerships follow a model known as action research, whereby research is intended to address and help solve very specific problems. In the example I referenced earlier, the Indianapolis Violence Reduction Partnership came out of discussion with the mayor and the chief of police, where I was asked, so Doc, what does the research tell us we should be doing to reduce homicides and shootings? I sheepishly looked around the room hoping there was another doctor that could provide an answer, because at the time there really was no evidence base in terms of how to reduce serious gun violence. What we did decide to do was to enter into a partnership where we would use research to help better understand the violence problem, develop and test interventions, and evaluate whether we were having an impact on gun crime. I like to think of this as research-informed practice and practice-informed research. Through these years, another common finding has emerged. Even when we can identify an evidence-based practice appropriate for the problem we are addressing, our efforts often fall apart when we try to implement the strategy or intervention. This is true not just in criminal justice, but across all areas of public policy, including health, education, social services, and beyond. Implementation is very difficult. By its very nature, it calls for us to change our usual way of doing things. There may be resource constraints. It often requires coordination across a variety of units and divisions within the organization or across multiple organizations. These and a number of factors lead to research that shows most efforts to innovate with new practices, interventions, and strategies fail. And when successful, it takes significant effort and a long time to actually implement these new practices. Thus, it becomes critical that as we plan to adopt evidence-based and evidence-informed strategies, that we think seriously and work tirelessly to maximize the likelihood of meaningful implementation. In this action research model, we suggest that the research partner work collaboratively with your implementation team to continually assess and provide feedback about implementation. Similarly, the research partner can play the more familiar role of an evaluator who, in addition to monitoring implementation, can work with your team to develop and ultimately assess the extent to which you have achieved your desired outcome measures. When I talk with criminal justice professionals about their experience working with researchers, I often get widely varying responses about that experience. Some talk glowingly about long-standing relationships that have proven mutually beneficial and can point to how the relationship helped inform practice. For others, it is more mixed. Perhaps they found an evaluation report helpful, but the partnership remained fairly limited. For others, it has been a negative experience. In some cases, there were initial conversations, and we provided the researcher with access to data, but then we didn't hear anything until we received a hard-to-decipher technical report or journal article. In other cases, the researcher did something based on their own research agenda, but that it offered nothing of real value to the criminal justice professionals. Each of these situations probably has its own dynamics, but I think oftentimes it is due to a lack of shared understanding of what we expect from the partnership. Criminal justice professionals may just assume that the researcher knows what he or she is doing, so I guess this is what to expect from the partnership. For many researchers, the action research and research partner role is something new and unfamiliar. Most of us researchers are trained in conducting basic research. This is research whose primary purpose is producing new knowledge. An example might be a researcher asking whether there's a biological or genetic predisposition, or whether it's early childhood experience or other factors that relate to sexual offending. The findings may ultimately inform practice, but that is not the basic purpose. One of the great aspects of being a researcher, particularly a university-based researcher, is that we are given a great deal of autonomy to pursue this basic research. As I noted earlier, the action research model is different. Here we are conducting research to solve concrete problems. Examples might include, is this particular intervention for sexual offenders effective? If so, for what offenders? And what are the keys to effectively implementing this intervention? This is the type of information that is of value for our criminal justice partners. The research partners, much like my physician example, should also be well positioned to assist their partners in identifying existing evidence-based practices, considering evidence-informed strategies when no clear evidence-based practice is available, as well as identifying practices that research has shown to have no effects or even negative effects. Consequently, it is a broad role that the Smart Justice model has in mind for the research partners and the partnership. This point was driven home to me by a prosecutor from a major jurisdiction who had extensive experience working with researchers. I was presenting on research partnerships, and he raised his hands and said, "You mean I could have been asking my researcher to help me with all these issues?" His experience had been with researchers in a very traditional evaluation role, where they met to discuss the intervention, collected data for a long time, then issued a final report with a thumbs up, a thumbs down, or the often, well, the findings are not really clear and call for more research. We recognize that there's a lot of variation across the various grant programs. Sometimes you may be involved in a planning process or a pilot study where it may not be appropriate to conduct a full-blown outcome evaluation. Some projects may not have the financial support for the researcher to take on every aspect suggested in this graphic. However, we think it important to have this broad perspective on what the research partnership can potentially bring to your projects so that everyone is on the same page and the research partnership can be of the greatest utility to the criminal justice partners. Finally, for the research partners attending this webinar, my experience has been that while our focus in these partnerships is on action research, evidence-based practice, implementation, and evaluation, oftentimes being involved in these partnerships creates opportunities for also asking basic research questions. The key is remembering that this is a partnership that needs to be mutually beneficial. To be a bit more concrete in terms of the action research model, these are the areas where the researcher should be able to bring value to the partnership. One of the things we know is that our strategies and interventions are most effective when they are highly focused on specific problems. In the corrections arena, this often means matching interventions to specific client needs. Thus, the research partner can provide ongoing assessment of problems to inform the identification and selection of strategies. The research partner can be a resource for strategic planning, and including the researcher in such planning will help inform their assessment of implementation and ultimately the evaluation. When I talked about the contrast between the basic research model and the action research model, I alluded to the fact that most researchers have been trained in the basic research model and may find this broader action research model is foreign and unfamiliar. Much more common, researchers have been trained to be independent evaluators and to be outside the problem-solving process found in criminal justice practice. Thus, it is not surprising that some of these partnerships have failed, have failed to develop, as there may be a mismatch between the perspective of the researcher and the expectations of the criminal justice partners and the smart justice model itself. So to reiterate, what we are hoping to see in these smart justice projects are, battling a cold. What we are hoping to see in these smart justice projects are true partnerships that reflect research-informed practice and practice-informed research. At this point, let me turn this over to Faye Taxman, who brings years of experience in working collaboratively with correctional agencies and courts.
And hopefully you're a little bit cold. Why I talk about action research models in the field of corrections, both covering pretrial, probation, prison, reentry, the whole spectrum. So the question with action research models is that the research partner, as Ed has talked about in the smart justice model, is a partner at the table, which means that the person or persons who are the researchers are basically involved in the research process from beginning to end. And that actually means sometimes defining the issues. It means helping look at sources of data collection. It means looking at trying to do piloting or pre-testing or strategic work to think about how to develop targeted interventions or solutions for problems that corrections agency, and I'm using the term corrections here very broadly. But the strategic work is really trying to really look at what is the issues that are preventing the outcomes that are oftentimes desired. And in the field of corrections, we're primarily focused in on reducing recidivism, improving fairness and justice within the system, reducing revocations, and giving the people who are involved in the system opportunities to address the drivers that affect their engagement in the criminal justice system. But sometimes you have to do a strategic analysis to really look at what some of those targeted interventions are that would better fit within the organization or organizations or community that they're actually being implemented or proposed. And then developing the appropriate feedback data so that you can look at how well are things going? What difference does this intervention actually seem to be making in terms of what we hope to see accomplished? And then the longer-term impact of basically looking at whether or not we've affected that desired outcome of reducing crime, recidivism, technical violations. So the action research model, and this, as Ed has already illuminated, it is something that some researchers are trained in and some researchers are not. And it's also something that some practitioners are comfortable with, this open disclosure, the ability to sit around and really talk through some of the difficult issues that occur in designing, implementing, and refining procedures and protocols that have an impact on client-level behavior. So it's a bilateral issue about whether or not it's a partnership is something in which it's open and trustworthy. And that's something that's really important in the action research model, is to establish a strong partnership up front. Okay, so just to give you some examples, and Sheila in the beginning kind of went through the portfolio that the NRRC has, but these are examples where there have been in practice very strong research partnership. So like Ed, I'm going to date myself a little bit, going back to the early years of RSAT and problem-solving courts in the early 1990s. During that period of time, the first set of grants that were given out by the Bureau of Justice Assistance, or at that time it was called the Correctional Program Office, those grants mandated that there were research partners, and that those partners were responsible for doing a process evaluation and then also doing an outcome study. Now, several years, during that period of time, actually those were separate grant options where CPO, the Correctional Program Office at that time, gave the funding to practitioner organizations to implement the new initiative, and the National Institute of Justice gave the research grant to the research community, and the request was that those organizations would work together. That model of funding has evolved so that the current model is currently that, BJA, the Bureau of Justice Assistance, actually puts out solicitations, many of which I'm sure most of you are looking at right now, and they put out those solicitations that include the innovation that you plan to do in a particular area, and then recommend that you have a research partner that you include as part of the application. The funding levels that are included basically are funding levels that actually have to do with both, dealing with the programmatic as well as the research components. What is effective in terms of these research partnerships as in the Smart Justice model or the action research model that Ed has basically gone over is that this is a collaborative process, and if you were working on new ideas for the grants that are due relatively soon, I highly encourage that the researcher and the practitioner organizations work together on that grant application, because that's the best way to really develop ideas, but also to start building that trust in the partnership, and that's an important component. So what we've seen in the BJA Smart Suite initiatives is more emphasis on research partnerships. And that includes in smart supervision, it includes in the reentry component, and in the co-occurring disorders, or the justice and mental health initiatives. And why do we see that? We see that because what we have learned in the research literature, and there's actually scientific literature on this. In fact, Mark Lipsey has done several meta-analysis, which are summaries of the literature, and he basically has found is that you have higher quality programs, better implementation when there's a researcher in the team, when the researcher is partnering with the agencies. And one meta-analysis that Mark Lipsey did in 2006, he basically shows one of the strongest effects, and particularly on implementation, has to do with the presence of a researcher on the team. So there's a lot of benefits, and I highly encourage anyone who's interested in really thinking about, at this time when you're putting together applications or you're starting to really begin to implement your current grant, if that's what you have, is that you bring in your research partner and, try and have consistent discussions across the spectrum of issues that Ed, identified, which is how are we assessing the problem, what strategies are we going to use, how are we going to develop data collection, what are the measures we're going to use to assess implementation progress, what are the measures we're going to use to assess fidelity, and then how are we going to evaluate the impact of our initiatives. So there's a long history and a strong history in research partnerships. Actually, you know, how I got started in my career was with a Center for Substance Abuse Treatment Research Partnership Initiative, and then a Correctional Program Office Initiative on RSAT. Okay, so let's talk a little bit more about the common ingredients for a quality action research partnership. So one is that the focus of attention is really around focused, effective strategies and interventions. Now, we all know there's a big laundry list of evidence-based practices in our field. And that laundry list is helpful to identify a practice. But the reality is that to implement that practice in your jurisdiction, in your organization, there really needs to be much more attention to how to make it fit. And that means looking at who your target population are, the characteristics of your staff, the amount of resources available for that particular program and services, as well as how are you going to monitor the quality or the fidelity of that program. So one common ingredient is that the research partnership should really be looking at these laundry lists of effective interventions or strategies, and then thinking about how does that fit within your organization and what kind of tailoring will you need to do. What's nice about having a researcher in the room is, you know, and pardon me for implying this for any researchers, but, you know, we may not be as busy as some of the, you know, our partners, having less to do with running programs and running operations. And therefore, we can look at the literature to get a better sense of when you target a particular intervention for a particular population, will you get the same results? So, for example, I'm working right now with a jurisdiction in which they are trying to implement a CBT program for young adults, 18 to 25-year-olds. Now, what we learned in that by looking at the research is that, you know, there are some neurological developments and age-appropriate developments that we need to take into consideration to modify that CBT program so it's more appropriate for that target population. We also have learned that for targeting that we need to pay much more attention to how we incentivize behavior and not just sanction, because, you know, at that age group, incentives, well, we know incentives work best anyway, but they work even better for that population. So those are different ways of focusing your strategies, but also thinking about how to adapt them or transport them into your own setting with your own characteristics. So that's one aspect of an action research model. Another is that you want to have a partnership. And a partnership means having working groups, working together to problem solve, and really having an ongoing, consistent dialogue. I used the term trust before because there has to be a trust that if an agency indicates a particular problem area, it's not to be perceived as a weakness, it's to be perceived as something that we really have to consider as we move through the process of really trying to improve what it is we're designing to fit within that particular agency. So you need to use a problem-solving approach, and we'll kind of walk through one that is recommended here as a way of really being able to look at, does the intervention, does the strategy we're using, do the measures we're using, are they going to generate for us the type of information that we really need to get to? Okay, so what is that problem-solving strategy? So the problem-solving strategy is basically, a focus on analyzing the problem, coming up with solutions, and these solutions you may want to test out by implementing them. We often use the term pilot. Pilot meaning you give it a short run and see if you can get any traction. But the notion here is that you really want to see, does it fit within your environment? Can you address the problems that you think exist? And then, we want to build in assessment and feedback loops so that you can constantly redefine the problem, assess your strategy, look at implementation, and see whether or not you're actually providing feedback at all. So this problem-solving strategy is, to be honest, it's not rocket science, but it's methodical. It's something that a team can do together, and it brings the team together to really discuss important critical issues that they can actually try to work together to figure out a way to resolve them. Part of the problem-solving model is really providing feedback, and this is where researchers can be very helpful because of the expertise and skills at using data, creating data, either through focus groups or interviews or surveys or using management information systems. But that's, as a researcher, we are trained in using data as a way to basically look at the problem from different lenses, to look at how well we've actually done. So the strategic planning module, from my perspective, really hinges on that feedback and how we can basically improve the feedback that you are getting to really look at where are things working out, where are you having some difficulties, and what areas might you want to make change. But this takes a methodical process. It takes people sitting down and working through a problem analysis, solution, reviewing, feedback loop so that you're all on the same page as to how well things are working. Okay, so what do we know? Well, in our field, where we're mostly interested in improving behavior of people involved in the justice system, we know that the more we have well-designed, specific, and focused interventions. Now, what does specific and focused mean? Specific means we're identifying a certain type of behavior. We're trying to interrupt a certain type of pattern. Those are critical because we have to think about the people involved in the justice system as having some type of comorbid, I like to call them the mix of risk-need profiles, and we need to be responsive because there isn't a generic solution. You can't use an intervention for a substance abuser with a heroin addict and use the same intervention for a gang member. You're not going to get the same results. So we have to be focused on who the population is, and we have to be specific in terms of who the intervention is. So this particular slide talks about the police because of the focused deterrence model and the emphasis there on really trying to get the police to be much more specific about who they're targeting, what's the specific interventions, but the same is true for corrections. And in fact, if we look at our implementation research, we know very clearly that when you have very diverse populations in a treatment program, you're not going to get the same results as when you have people with similar problem behaviors within that program. So that's one of the things that the research partnership can look at. Who's the program for or intervention? What are you targeting? And is the program elements designed to actually do that? And those are difficult conversations, oftentimes requires data to make sure that we have the right characteristics, and then you map the characteristics of your clients to what those interventions actually offer. So let's look more directly at an example. And this is in our field in smart supervision and focused intervention. So as the BJA initiative states, the smart supervision basically requests that each jurisdiction have a criminogenic risk and need instrument so that the jurisdiction can assess these factors, that there is an emphasis on employing tailored case planning systems that inform supervision, that there is a use of incentives, which we know is the most effective in influencing behaviors, but because we're concerned with public safety, we also want to make sure that we have responses to those behaviors that affect public safety, so sanctioning people. And then we want to basically recognize that while our target of attention is to the clients who are being served by the system, that the staff who you're asking to do these new work processes actually are being incentivized to really work on a way to reduce recidivism. Now, each of these bullets in and of themselves are relatively clear-cut, but they do offer some challenges. And these are challenges that your research partnership can actually focus attention on. So let's take the first one, effectively assess criminogenic risk and needs. So one of the things a research partnership can do is actually ask the question, is the instrument that you're using working well for the population that you're applying it to? In other words, are we getting the same results as you would expect? In many situations, research partners will help to identify where to adjust cutoff points for different risk needs levels. They will also be able to look at whether the instrument is perfectly matched for the type of population, and in some cases you may need a different augmentation of an instrument, like, for example, adding on a substance abuse screener, like the ASI or the TCU drug screener, particularly if you have, pretty drug-dependent populations. So these are things that you may want to really consider. And your research partner can actually help you look at each of these bullets as an area in which you want to do a different type of dive into, is there a problem here? How are we going to strategize to improve how we use these core components of evidence-based supervision? Okay, so, here research can inform us as to the characteristics of each of these. It can also inform us as to how well we are doing in terms of implementing these core components. So let me take a second now to talk about the research partner. And the reason we wanted to do this webinar and that the Council of State Governments asked Ed and I to co-host this with them was really because a lot of jurisdictions haven't had opportunities to really work with researchers, or there's a little trepidation about having someone at the table who, thinks about numbers all the time or thinks about, what does the research literature say? But really, I hope that one of the conclusions you draw, or the takeaway points from this webinar, is that the research partner can be a valued component of your team. So here the research partner assists your team in gathering data. These are things that, expectations that you can set up. And, you know, we recommend heavily that you talk through these ideas about what the partnership looks like. But one is that the research partner can assist the team in gathering data, synthesizing information, and actually looking at effectiveness of different strategies. Obviously, they can go to the research literature to learn from others, you know, from what the literature states and studies that have been conducted. But another source is actually talking to their colleagues who are working in similar studies and projects. And because researchers have our own little community of conferences that are separate from practitioner conferences. So one big one is called the American Society of Criminology. A lot of networking goes on there where people just share information about how they're handling situations, how they're collecting data. So your research partner can actually be a source of information for you. A researcher is also an extra set of eyes. Because researchers aren't part of your organization, they're just team members, they can give feedback. They can help other people in the room understand why it's important to move in a certain direction. In many cases, the researcher is also fairly neutral. And if they're not neutral, I would suggest you might want to find another researcher. But really, that's part of our job, is to be objective, to be data-driven, to kind of report back to you what we're learning and help understand the context of why the findings are what they are. I know people get really nervous when you see a study and it says it didn't work, right? There was no difference between the treatment group and the control group. And people usually say, oh, well, then it was a waste. But it may not be a waste. And in fact, you know, there's a current debate going on right now because of some of the recent research findings on swift and certain. That was one of the BJA, NIJ initiatives. And in that particular study, there's actually a lot that we learned about, you know, the effectiveness of the swift and certain model, but we also learned about the capacity of programs to really implement that rigorous of a model, and that, you know, if standard supervision might change to include some of these features, we might have some impact on some of the legitimacy more attached to those models. So those are important findings. And, you know, your research partner should really be that objective person who can fill in the blanks for you. And then, of course, you know, everyone comes to the table with different expertise, and researchers have a different set of expertise than practitioners. Okay, so we see the added value in these different domains. You saw this as the problem-solving model. But here, you know, we're, you know, the extra set of eyes, the objectivity, the, you know, information from the research literature and or other colleagues really adds a value to your team because you can learn more about what you can actually, you know, accomplish or get out of a particular initiative. The other part of research is this part about ongoing assessments. And those, you know, part of the ongoing assessments is to basically provide a platform for getting feedback and learning more as we do. So the components of action research actually allow us to ask some things that some people see often occurring in process evaluations, or they could also occur in implementation studies, which has to do with fidelity to the model, which has to do with some of the, you know, segue of trying to actually move people into programs, which we know oftentimes is a challenge. And so you have the opportunity of basically asking the question of, you know, did we say what we said we were going to do? Did it start generating some of the findings we thought would actually occur? And are we getting the desired outcomes that we thought we would occur at that stage? So there is an ongoing sort of assessment. Okay. So I am now going to turn this back over to my colleague, Ed McGarrell, and Ed is going to talk about researcher responsibilities, skill sets, expectations for the researchers, and then we'll conclude with sort of expectations of the agency. So, Ed?
Thanks, Faye. As you can see, you know, and as Faye has described, this problem-solving model and the idea of action research is suggestive of an ongoing and dynamic nature of the research partnership. This can be thought of as an iterative process where the criminal justice professionals and the research partner work together to learn more about the problem, use that to develop strategies and interventions, inform planning and implementation, and ongoing monitoring, and ultimately evaluation. I sometimes worry about losing friends in the research community because we are asking them to be actively engaged in a very broad role. On the other hand, I think many researchers find this work extremely rewarding. The action research role also provides challenges and forces us to be creative. Oftentimes, the data that we'd like as a researcher are not available or stored in case management systems that do a nice job of storing information on clients, but often were not built to generate research data. In my research partner role in Detroit, I shared some preliminary findings from an analysis of the geographic patterns of shootings at last week's meeting. There was a lot of interest in the findings, and I was asked to write up a summary for a meeting that will occur tomorrow. I'll leave this webinar and try to find some time to write this up. This is a real contrast to my more typical researcher role, where I'll write up my research findings at my pace when I have some free time to do so. However, as a research partner, I want to provide this information in timely fashion, particularly since my partners are very interested and this information may inform decision-making. By the very nature of our educational background and research experience, the researchers are typically seen as bringing some degree of expertise to the partnership. Many of us researchers are used to standing in front of classes with students who've paid large tuition bills for the privilege of hearing us talk. At the same time, unless we've worked in the field of practice or been actively engaged in these types of research partnerships, we often have very limited understanding of the day-to-day realities of supervising probationers, or providing therapeutic interventions, or deciding how to connect re-entering clients to services, much less the realities of how complex correctional agencies operate, how responsibilities are organized, how caseload sizes manifest themselves in practice, and how formal and informal systems of rewards function in our partnering organizations. It is important to realize that there is significant learning for all involved, and that we all need to develop and nurture the partnership in a way that provides value for all involved. As Faye described, one of the benefits of the researcher is that we are a step removed from the day-to-day responsibilities. The researcher is often well positioned to take some of the problems identified by the criminal justice partners, gather and analyze data, and present and discuss the findings with the partners. The real value is often this discussion where practice informs research and research informs practice. I don't know if this is the case with many correctional agencies, but many of the police departments I work with have had experiences with researchers where data has either been misinterpreted or researchers have used data and analysis in a way that was seen as harming the agency. In one of my earlier experiences, I used police calls for service data to provide an analysis for my partner agency. When I presented the findings, they did not make sense to my criminal justice partners. It turned out, although the calls for service data were a good indicator of calls to specific locations, the way in which the call was classified, for example, whether it was classified as a burglary as opposed to an assault, were often inaccurate when compared to the more detailed investigative report. This could have been very embarrassing for me, but through discussion with my partners, we had a much better feel for what you could and could not learn from this particular type of data. As we were studying effective and less effective research partnerships, we interviewed a number of criminal justice professionals and researchers about some of the elements that tended to create more positive and lasting research relationships. One was the importance of providing something of benefit to the practitioners throughout the project. There is often a tension for the researchers because we are trained to be very cautious and careful in interpreting and sharing our findings. We want to know we are on solid ground before we present our findings. In contrast, our partners are facing day-to-day pressures to address real problems and issues. We heard that providing short briefing papers and interim findings, as opposed to waiting for a final comprehensive report, can be very valuable. Another suggestion we heard was the value of finding buddies in the partnership who can go to the researcher and talk through issues and challenges, or who can be a listening ear for the research partner. In one of my partnership projects, I conducted an analysis that revealed pretty negative and unintended findings related to one of the agency partners. I felt ethically obliged to share these findings with the partnership, but I was also quite concerned that the findings could be used for political harm as opposed to fixing a problem. Having a buddy that I could talk with and who could work with me to find a constructive way of presenting and discussing the findings was critical for the research to have a positive as opposed to a negative impact. Of course, in any partnership, it is a two-way street. Just as there are expectations for the research partner, so too are there expectations for the partnering agency or agencies. If the researcher is to address problems and issues of importance to the criminal justice partners, they need to really understand the nature of the problems and issues from the perspective of the agency. I was once called by a prosecutor who was extremely frustrated that they were not seeing any work products from the research partner. I asked whether the team had discussed this during their meetings. I learned that indeed they had, but that the research partner was not included in their regular meetings. That's a pretty high hurdle for an effective partnership. Just like we are asking the research partners to be creative and flexible, so too for the criminal justice professionals. In most of our organizations, there is someone whose standard response to any proposed changes is, "We can't do that." Hopefully that's not true for your partnership, but the very nature of these partnerships and the problem-solving model is to figure out how we use the partnership to continually improve our processes and outcomes. These partnerships also do not occur in a vacuum, but rather arise in varying contexts in terms of the experience of working with researchers, whether prior efforts were perceived as positive or negative. A real challenge in criminal justice is that we often do not have clear outcomes. This can be due to varying conceptions of outcome measures. For example, do we consider recidivism to be any arrest, technical violation, a conviction, or return to prison? If we see a reduction in recidivism, do we have a justifiable comparison group from which to judge the meaning of the reduction? I noted earlier that oftentimes the agency information systems provide a valuable case management tool, but sometimes are clumsy for providing data for research purposes. As Faye indicated, having regular discussion about these and related obstacles is really critical for the research partnership and ultimately for the research to have value for practice. We've been describing a very broad and robust research partner role. However, it is almost inevitable that funding will create limits on what we can accomplish. We might not be in position to conduct a problem analysis, assess implementation, and to conduct an outcome evaluation. For the success of the partnership, we need to discuss what we'd like to accomplish and then what we realistically can accomplish given our context, the time we have to conduct the project, and our resources. It also takes time to design research, collect and analyze data, and have something of value to report. For the researchers, we encourage you to think about interim products that can be of value throughout the entire project and that can build the partnership while at the same time thinking of longer-term research products. Ultimately, there are no pat or canned answers to addressing these challenges and obstacles. However, by having a shared understanding, having continual and ongoing dialogue, and mutually addressing questions about the partnership, you can greatly increase the likelihood for mutually beneficial collaboration. Finally, some concrete recommendations are to plan early, communicate regularly, jointly work together to develop key project products and milestones, and have processes that allow for ongoing assessment and feedback. Some have equated the research partnership to a marriage. There's no clear blueprint, but hard work, commitment to the relationship, open lines of communication, and a willingness to be flexible all seem to be keys to a positive relationship. The payoff for the research partner can be greater understanding of crime and the criminal justice systems, access to data and professional knowledge, research products, student opportunities, and the knowledge of having contributed to the criminal justice system, its clients, and the broader community. For the criminal justice professionals, the payoff can be greater efficiency and effectiveness. Ultimately, the payoff for all of us is greater community safety, improved outcomes for correctional clients, and a more just criminal justice system. We hope that this webinar will be of value as you plan your project and the integration of the research partnership as a core aspect of your work. Thank you, and I think we will now see if there are any questions.
Thank you, Dr. McGarrell and Dr. Taxman, for that very informative presentation. As Ed mentioned, we will now begin the question-answer session. To ask a question, please type the question into the Q&A panel, which is on the bottom right-hand side of your screen, and I will moderate the questions coming in from the participants. As I mentioned earlier, we'll do our best to answer as many of your questions as possible in the time remaining, and if you have any additional questions, you can reach out to us. So Ed, we've had a couple questions come in. One from an attendee who states, with multiple initiatives underway in our community, including JMHCP, county-funded reentry services, and mental health programs, we are wondering about the feasibility of developing a single research partnership for all programs rather than separate research.
I think that's a very interesting question. I don't know if I can give a clear answer. I think there are many advantages to working with a single research partner, particularly if that partner proves to be, a valuable resource for the initiatives. I think, there's a tendency in many of the grant programs that come about because we're busy in our day-to-day operations is to think of these as discrete projects or activities. And I think one of the advantages of working with a good research partner across multiple projects is it creates an opportunity for learning across various initiatives. And I think that can expand our thinking beyond a grant-to-grant kind of focus a different way of doing business. And I think that where that can happen with a single research partner or research partner team, kind of common approaches, common understanding, trust built across multiple divisions and agencies can be very valuable. I suppose the caution on that is it's like investing in one stock versus a whole broad portfolio. As that relationship is positive and mutually beneficial, I think that can work really well. There may also be benefits if these are new relationships to experiment with different research partners and learn, where those relationships are really are providing mutual value, and then build on that. So it's probably a matter where local context is important in figuring out the answer to that. But I can see many benefits for a single relationship, while at the same time, if it's a newer set of relationships, there may also be benefits in working with different research partners.
Absolutely, thank you. The next question that we have here is, how can an individual mental health professional approach prospective research partnerships?
That's a great question, and I think this becomes one of the challenges that I think many communities experience. Obviously, if there is a local university where you may have existing relationships, that's oftentimes the easiest course. In all the states, there are statistical analysis centers that often have teams of researchers that are interested in policy-relevant research. George Mason University, where Faye is located, their Center for Evidence-Based Practice maintains a database of researchers who are interested in this kind of collaborative work. And another great source is to reach out to the Justice Center at CSG that is, part of this national network that the Bureau of Justice Assistance has put together. And oftentimes, we can help create or identify potential researchers that may have been involved in this kind of work in the past and who may be of interest in working with you.
Absolutely. And that's a question that comes up quite a bit with our JMHCP and our SCA grantees, which is just simply how do we start the partnership. And another resource when looking for partnerships is is NTAC, which is run through BJA. They are also willing to, you can put an RFP through NTAC and they'll reach out to their partners to be able to see if there would be anyone that would respond to that RFP. So NTAC would be absolutely another resource to use for that. Okay. Next question is, okay, so given the action research model, would it make sense to have a multidisciplinary research team, i.e. criminal justice, social work, psychology?
I think oftentimes that is a great approach. Many of the complex issues that we face in criminal justice, I think particularly in this area of mental health issues within the corrections system, it really does call for the broad skills and perspectives that can come from a multi and interdisciplinary team of researchers. I think many of the same questions or themes that we've addressed in terms of the partnership between the researchers and the criminal justice partners will sometimes arise in the context of researchers that come from different disciplinary traditions. But I think if there are partners that can bring expertise related to corrections and mental health and service delivery and implementation, that having that kind of interdisciplinary team can be extremely useful. I've had the benefit, despite the fact that Michigan State University and the University of Michigan are diehard rivals on the athletic field, we've had the good fortune of working with a team from the School of Public Health at the University of Michigan, along with our group of criminologists in a series of initiatives. And I think it's proven very valuable to bring the complementary expertise that comes from public health and criminology in these initiatives. And I think we've been able to bring different types of analyses that have proven useful at the local level that if either one of us were working alone, probably would not have made it into the mix.
Yeah, absolutely. Having those different perspectives, I think, can help. I mean, for the most part, they come across as more.
The other thing I would add to that, Sheila, is again, I think that keep in mind the Justice Center as your TTA provider. Sometimes, there simply aren't the resources available to pull together that type of multi and interdisciplinary teams. But depending on the background of the research partner that you're working with, if they're experiencing questions or issues that may fall outside of their particular area of expertise, reaching out to your technical assistance and training provider, can help link to other researchers and other expertise who may be able to come in and assist with addressing a particular issue, whether it's a data need or an evaluation need or different strategy considerations, and so that expertise of your research partner can be complemented through the kind of training and technical assistance provided by the Justice Center and our team and Faye's team and the others TTA providers that the Bureau of Justice Assistance has assembled. And as was indicated earlier, the NTAC system with BJA is oftentimes very valuable and very helpful in identifying and locating the kind of resources that can be very valuable at the local level.
Absolutely. The next question is, can you provide a concrete example of what a strategic analysis looks like that resulted in developing an intervention?
Sure. I probably am not as well equipped as Faye to give you well, hopefully I can give you a couple examples come to mind. I'll begin with the area which I'm most familiar, which would be, working with police and community coalitions in addressing gun violence. In some jurisdictions, we find that the gun violence is driven by gangs or groups or networks who are involved in shootings, where much of that violence has a contagion kind of nature, where you'll find retaliatory kind of violence. The problem analysis or strategic analysis can help identify the extent to which the violence in a particular community may be driven by that group dynamic, in contrast perhaps to domestic and intimate partner violence, in contrast to individual disputes and arguments that may be erupting in violence. And depending on the analysis and the proportion of violence in a particular community attributable to those different dynamics, they call for a different set of evidence-based and evidence-informed strategies. And we've seen that play out in some of the communities that we're working with, where at one level there are a lot of parallels across communities, but when you dig a little deeper, you'll find that sometimes there is this variation across those types of violent crime that suggest different interventions to have that prevention impact. I think in the correctional arena, it would, what comes to my mind is the kind of analysis that you'll see in the risk, needs, and responsivity principle, where you're really trying to determine, on the basis of your specific clientele that we're dealing with, what are the most appropriate set of interventions that can be linked, to the nature of our clients, whether that's in a community setting, in a specialized court, or in a correctional institution. So I hope that helps. So that's the basic idea of conducting that kind of strategic analysis in terms of, in our given jurisdiction, in order to address this particular issue, what are the characteristics of the neighborhoods or the clients associated with a particular problem that is occurring and recurring in our community or in our caseloads, and then on the basis of that analysis, linking that to specific evidence-based strategies.
That's a great example. The next question is switching gears a little bit, and this attendee asked, what are best practices for incorporating those with lived experience with the criminal justice system and their families in the research practice partnership?
Well, that is a great question. Yeah. And if you remember when we were talking about the role of the researcher, one of the points that we tried to make was thinking about being flexible and creative, and thinking about the sources of information that we use to bring to bear as part of our problem analysis, as thinking through the strategies or interventions that are suggested by that problem analysis, as well as understanding implementation challenges. Again, I'm a little more limited in my ability to provide corrections examples, although the particular idea that I have in mind, or example I have in mind, has a community corrections component to this. And this, some of you familiar with that may be familiar with the ceasefire model, or the parolee forums for people returning, from institutions back into the community. Some jurisdictions have used an approach where they will have what's sometimes referred to as a call-in meeting or a parolee forum. In this particular example that I'm thinking of, they took what's considered an evidence-based strategy, which involved meetings when parolees who had previously been involved in gun violence were invited or told by their parole officer to attend a community meeting. And at this meeting, the intent was to welcome the individuals back to the community, to warn them about the fact that the research suggests that given their situation that they are at some risk of being involved in future gun violence, and that as as someone with a felony conviction, that they were prohibited from carrying a gun. And that message was coupled then with an attempt or the voice of the community welcoming these citizens back, as well as reference and linkage to services, reentry services that are intended to support that transition back to the community. The particular community that we were working with had taken these ideas and were communicating these or those messages in this meeting. And in trying to assess the implementation of the strategy, the research partners included some of the service providers were people who had previously had lived very similar experiences, where they previously incarcerated individuals who had come back into the community and had successfully integrated into the community, and now we're trying to provide these services and this welcome back to these returning parolees. And what the researcher found in debriefing these sessions was that the way in which that message was communicated was critically important, and that if it was perceived, if some of the kind of harder edge tone of that message around the the fact that of an elevated risk of future victimization or participation in gun violence, or the threat of being subject to laws prohibiting a felon from being in possession of a gun, if that was done in a very respectful way of providing information, that had a much more positive effect than if it came across as a threat, and that the threat message, and I don't think it was intended to come across that way, but for someone who had served their time and was coming back into the community, it was a fine line between a message of information and support as opposed to what might sound as more of a message of threat, and not acknowledging the fact that the person had served their time. And I don't think that would that fine distinction may not have come to the attention of the participants if they didn't tap into that voice of community members, who had more similar experiences to the parolees that were participating in this. And so the incorporation of that voice was really valuable in helping to refine, this what's considered an evidence-based practice. So that may be a long-winded way of responding to the question, but I think the research partners being aware of the multiple perspectives and voices from which important information that can help us better understand the nature of the problems that we're dealing with, the nature of the interventions, and the actual implementation and impact of that intervention, from multiple perspectives, I think can be very valuable.
This is also Sarah Worsberg from the Council of State Government Justice Center. Just to add to the answer for that, a lot of our grantees that are focused on behavioral health also have participant surveys to see how the people are responding to treatment for mental illness and substance use disorders, so that's often a component to it. As well as most of our grantees work with some type of task force, so reentry councils, behavioral health criminal justice advisory groups, and then they also often have implementation teams, and it's quite common for these to involve people who have had criminal justice involvement, for behavioral health programs, also people who have had behavioral health experience within the justice system as well. And the research partnership, the research partners should be a part of those councils as well, so that's another option for interacting. And many of the behavioral health programs also have peer specialists as a piece of it, so they, a lot of them actually are incorporating the people who have behavioral health lived experience, but also experience in the criminal justice system.
Absolutely. Thanks, Sarah. So one last question before we conclude the webinar today, and this is going back a little bit to the how do you create the partnerships, except from a little bit of a different perspective. So the question is, do you have any suggestions about how new researchers can initially reach out to agencies they haven't worked with before, especially if there aren't any shared contacts to introduce you?
That's a very good question, and I think it's very encouraging to hear from potential research partners. I'm trying to think of the best way to address that, because it's very interesting because as you can probably gather, I usually get that question from reverse, from the criminal justice professionals who are trying to find the researchers. And I think it's very appropriate because, particularly in the area where the Bureau of Justice Assistance is supporting these research partnerships, there are many agencies throughout the criminal justice system who are looking at these grant opportunities and would love the opportunity to work with a researcher. I think, if I don't, others can correct me, but I don't think it hurts to reach out, at an executive level to the, potential participating agencies. There can be, oftentimes there are criminal justice coordinating boards that will bring together, multiple agencies working in a jurisdiction. That might be a good opportunity. But I think, so many agencies are interested in pursuing these opportunities and working with researchers that, reaching out to the agencies, and I know it can be, particularly the Department of Corrections, state-level organization. It's a large organization with many layers. I think the other suggestion, would be to reach out to the Justice Center or to Faye or myself, because we are also in contact with BJA and with a whole variety of TTA providers, where it's not unusual for us to be in contact with different jurisdictions that are looking for research partners, and we may be able to facilitate some of those contacts through the broad network of the BJA program managers, as well as this training and technical assistance network.
Yeah, absolutely, and that's what that would be my suggestion as well, is just reaching out to different agencies, your local sheriff's department, your local behavioral health providers within your area, and just reaching out to them to see if they're looking for a research partnership. Another suggestion is on our website we have a map that we refer to as the NCJI map, and it has all of our current and past grantees that we've worked with. And so, I would encourage you to go onto that map and take a look at different grantees that might be interested in a research partnership.
The other thing that I would add is that some of our grantees actually work with graduate students to get specific smaller program analysis. So sometimes at universities they might have the ability within a class to be able to do some analysis for programs, sometimes even at no cost to the program, and that's a great way to start the partnership, so that way they get a feel for the types of services that can be provided. And we've seen that a lot of times lead to you know, a research partner being written into a grant in a more comprehensive way.
Mm-hmm. That's a great point, Sarah.
You want, listening to that comment, one additional point that just comes to my mind, and this may be unique to my own environment, but we have active internship programs with a number of agencies that where we're placing students. And one of the things that it does is it provides a nice entree to the organizations. And you know, it's probably not going to be our internship contact person that's making decisions about entering into research partnerships, but they likely, you know, would be able to suggest who within the organization would be most appropriate to have that conversation with.
Absolutely. So we're at the 3:30 mark, so this will conclude our webinar for today. I wanted to certainly thank all of you who attended and participated in this webinar today, and a big thank you to our presenters, Dr. McGarrell and Dr. Taxman. We thank you very much for being part of the webinar today. As we mentioned earlier, we will email a recording of this presentation after the event, and the recording will also be available online in a few days on our website, which is csgjusticecenter.org. Thank you all again, and have a great day.